for contracts and they compete for services and they compete for funding. And you probably see it, your listeners probably see it all the time. You're going to get invited to golf tournaments. There's just so many foursomes you're going to be able to write a check for. So everybody is competing for, those scarce dollars. But those
Hello, and welcome to the Resilient Leader's Journey, a podcast where we navigate challenging currents of growth and change. My guest today is Craig Gordon, President and CEO of Communities for People. Craig, good morning. How are you today?
Trent, I've never been better. I'm living my best life. And if you want to believe that one in these challenging times, I've got a bridge I can sell you.
Outstanding. Craig, I know you have a psychology degree and a politics degree from Brandeis University. In one sentence, using those two degrees, can you please explain what's going on with our government?
I wish I could. That's a bigger question and a unfathomable answer that I could ever provide.
I would imagine somebody with your education and degree is you would be able to answer it, but if you can't, I guess the rest of us are out of luck too.
We all are. We all are. Take a dartboard or take a couple of dice and roll them.
Funny. Can you tell our listeners what Communities for People is and what your role is?
Sure. So what Communities for People is we're a small to moderate sized human service agency. We do a lot of child welfare programs in Massachusetts and Rhode Island. So then you kind of say, well, what are child welfare programs? And we have a lot of foster care, adoption. We run residential programs, group homes, independent living programs for older youth. It's kind of where our niche is. We have family preservation programs and child abuse and prevention programs, really trying to keep kids and families out of the child welfare system. So
Sure.
we've got a fairly solid array of different programs really geared towards kids and families that are in trouble.
Thank you. You're a nonprofit, I understand. Are you primarily funded through donation or is it through government funding?
Mostly government funding. So a lot of our services right now are through state contracts, both again in Massachusetts and in Rhode Island. So the same way the state might look for an agency or a company, let's say, to build a road, people bid on it. Well, that's a very similar procurement process that the state agencies do as well. So we turn in bids and offer programs that the state agencies fund. So we also have a combination of, that's probably 99% of the funding that we get. We also get a small amount of donations and Trent, if you're your listeners and you want to come to our Top Golf fundraiser in May is Child Abuse Prevention and Foster Care Awareness Month, we'll invite you.
Sounds great, Greg. Do you have, I understand, around 200 employees?
That's
in
correct.
Your organization? So it's going to be challenging. You're not all in one location, right? You're spread out throughout mostly Massachusetts?
It's really almost about 50-50 between Massachusetts and Rhode Island.
Okay.
And we are very far from centralized. So we are extremely decentralized. And most of our locations are, it actually is a great management kind of structure and decision that we made. If centralization offers an awful lot of benefits. In our world, though, that's not good for kids. It's not good for staff. So coordination of services is a real challenge when you've got small settings. So let's say, for instance, foster homes or group homes. If all the youth were in one big institutional setting, it'd probably be a lot easier to get food. But when you have many different locations, it's like, well, we're not going to have that food service, that Cisco truck drive up to just one spot and deliver food. Now we have to either say everybody's going to shop individually, which is exactly what we do because we want foster parents and we want residential staff and the youth to have as home-like and natural a situation as possible. But it now makes it very complicated. Now, instead of one corporate card or corporate account, you've got probably 30 or 40 different people going to the Shaws and the Star Markets of the world in the Stop and Shops every week to purchase their groceries.
So 200 people, and this is a high turnover industry, correct?
Unfortunately, it is. So our staff turnover, especially at those frontline levels, they are challenging positions. We work with some very challenging youth with very complex needs. Uh, Very often in this field, those become almost stepping stone types of career positions. So it's very common that some staff will leave after a year. Some staff start and say, wow, no matter how good those interviews were, no matter how much you thought you were preparing me for this, it is day 3 on the job and there will not be a day 4.
Mm.
The flip is we have some people that have been in direct service capacities for coming up on a decade. So there are some people who really, this is their calling, this is their passion, and our role is to really make it as meaningful and give them the tools that they need to be able to do their work with the youth.
How do you discern between those two types of people in your interview process, or before you get there in your screening process?
So this field these days, very common so we're in the behavioral health field, and we have the same challenges that the healthcare field has. The demands of, I'll say managed care, but really the demands of the entire sector are so complicated and so stressful that there is a workforce crisis. So you see it in nursing homes, you see it in hospitals, you see it in healthcare settings, all sorts of situations. Well, we have the exact same stressors. So we try to be very selective. And we do have certain proprietary screening criteria. So we certainly look for prior experience. We look for people who see this as a career rather than simply a job. Uh, the unfortunate situation that Communities for People is facing, as well as many of our peer organizations, are with the fact that the funding is coming from government contracts. There's always a concern about the amount and the rates. And you hear doctors talk about rates of reimbursement. You hear hospitals talk about rates of reimbursement. You see hospitals closing, merging. That's all those same things happen in the child welfare field as well, in the behavioral health field. So we really focus in our interviewing and in our screening to focus on people understanding, as I said, the pressures that the positions bring, the joys that the positions bring as well. And like I said, some people love this work, and the rewards are intrinsic to the nature of the work, and we are competing against our own peer organizations as well as retail and fast food that can offer better compensation than many of our positions actually pay. So if we're paying $21 an hour, people can get that. They usually, on their way to an interview at Communities for People, they're passing stores that are saying hiring at $20 and $21 an hour, and they get to pick their own hours, and they're less stressful positions, on and on.
You must be some type of salesman to do this, because I'm imagining young people get on planes, fly to Orlando, and walk into Walt Disney seeking a career to put on a mouse suit that they'll do for free. But I would imagine that you have to put on a really good presentation to drive these people. As you said, it's just as easy to go to Lowe's right down the street, or Chick-fil-A or the like. That's a different competition that you have. So what's the sell that you have to them? What's the reward that's not monetary that makes you a differentiator for them?
Well, that's two different questions, and I'm going to answer it two different ways. The first one is what you described in the earliest stages of my career when I was actually doing the interviewing
Mhm.
for staff. I thought part of the job was to sell the job.
Okay.
And I really learned that that was a disservice to the kids and the families. I would take my rewards as, wow, we actually hired 3 people this week, 5 people this month, and our staffing is almost full. This is wonderful. And then invariably, several of those people would say, you misled me. I didn't really understand this. You made it sound like it would be more rewarding than it is. And I'm thinking particularly of some of our direct service positions. Probably the best example I can give you is like working in a group home. On a Thursday night, when a youth gets a call from a parent who says, you're not coming home on your home visit this week, Johnny. I heard that you missed school 3 days. You're not doing it. The usual experience for something like that is the boy says, okay, mom, I understand. I'm upset, hangs up the phone, and then turns around to that residential staff person who's right near them and punches a hole in the wall.
Mm.
And that staff person is like, oh my gosh, is your hand okay? Oh my gosh, what are we going to do about this hole in the wall? I know you're really upset. Let's talk about a better way to handle your disappointment and your anger. And let me tell you that in the moment that Thursday night, those words do not come out of their mouth. It's like, oh my God, what the heck just happened? Probably a few colorful words. And,
Sure.
and, and do we need to go to the hospital? So we really learned that we need to, in our screening, to really depict the challenges that go with the position. Um, that really it became a flip rather than to sell the position, to really explain it. What the differentiator. So then you get to, okay, well, if we're really explaining that these are very challenging positions, what's in it for them? And what's in it for them is that they learn a whole host of great skills that they will be able to use in their professional development down the road. The other thing we're very, very proud of is uh, it. We've been able to build, I've been able to help lead one of the most competent, wonderful, skilled management teams that really, really, really care about our staff. So staff get tremendous degrees of support every step of the way. Our foster parents get support every step of the way. In our home-based programs, those are staff who are going into homes with very troubled and hurting families, with children in there, parents who maybe are in need of better parenting skills, and they're facing all those exact same types of stresses day in and day out. So you do that work, you come home with a lot of stress, and you need to be able to have vehicles to do it. So we really promote a lot of self-care, but we have very consistent supervision every single week. Our direct service staff get weekly scheduled supervision where they're able to talk about their challenges, they're able to vent, they're able to get the support that they need.
That's outstanding. I appreciate you correcting me with respect to selling because I understand exactly what you're describing. With your management team, if you this, what do you do to develop them? Does it start at the group home level, then it moves up to a regional director? And what's the hierarchy or career path that someone could look forward to? And how do you prepare them for it?
Yeah, well, great question. Uh, there's a couple of crossroads along the way. So many of our staff will start off in that direct service capacity. They're working directly with the youth, they're working directly with the families. At probably after, I'll say 1 or 2 years, if they have not left, they really have said, I kind of like what I'm doing. And now that's where we start saying, we want to help build you, career wise. So we can offer all the tuition reimbursement, which we do, graduate programs that some of our staff who might not have a bachelor's degree will help them get, college, go back to college, adjust their schedules to try to make all that happen. Staff with degrees, we can help do everything from kind of certificate and credential programs to going back for advanced degrees. And with all of that, we find that people really end up finding out, do they want to do the more clinically oriented roles within the profession or the more management oriented roles within the
What's
profession?
the difference between the two?
Well, so for instance, our more advanced clinical positions might be a master's level clinician. It might be a social worker. It might be a case manager who helps kids or families get the resources that they need. A clinician will do counseling and therapy.
Right.
The more management oriented positions are program directors, supervising staff, managing budgets, managing multiple facilities and multiple programs. There's a lot of overlap. So we certainly have social workers who take on some degree of supervision and support functions with staff. And we have program directors that certainly do a fair amount of direct service and know the kids and know the families that we're working with.
Sure.
But there is a branch that is kind of a crossroads. They diverge more and more and more. I'm probably a great example, probably the epitome of the management track, if you will. I like to say that's probably not a position I haven't held at Communities for People for at least a day. And the good news is the kids are much better off for the fact that I'm not providing direct counseling with them anymore. And ditto for the parents. So, but I actually feel very, very good that I'm able to support our management team and provide some leadership there so that they can help build our staff.
As the CEO, how do you find value in your job? What do you consider to be a good job?
Yeah. Great question. The answer has changed, and sometimes it changes every single week. Other times it's changed over the course of different years. So I'll tell you the current piece. Right now, my skills are called on uh, to face certain challenges at the very high systems level. And what I mean by that is both Massachusetts and Rhode Island face funding challenges. They're always looking for ways to improve the system of care. Uh, both state agencies or both states have state agencies that are trying very, very hard with well-meaning people with great considerations how to leverage, in this case for the state agencies, they're trying to figure out how to leverage federal funds.
Mm-hmm.
We are in an environment, as we're recording this trend, as you know, where federal funds under the Trump administration are really challenged, and no one knows what is going to be happening. There's executive orders happening day in and day out, Medicaid reimbursements that help fund get services to the states that in turn pass through to these community agencies are all either being curtailed or being threatened at being curtailed.
Sure.
I love trying to work with collective groups. I really believe in that very common folk saying that if you want to go fast, you go alone. But if you want to go far, you go with others, you go with a team. So I like working with other agencies. I like working with other associations these days to help make sure that the system that will fund these programs years out from now are able to sustain our staff, our programs, so in turn they are able to help families and the communities. It's actually where all of us come together. So the child welfare field in particular, but maybe the entire human service sector, there is indeed, it's very decentralized. So there's a lot of competition. And agencies do compete for contracts and they compete for services and they compete for funding. And you probably see it, your listeners probably see it all the time. You're going to get invited to golf tournaments There's just so many foursomes you're going to be able to write a check for.
Mhm.
So everybody is competing for, those scarce dollars. But those competitors all come back together for common goods and common needs. So the old school model was how to kind of fight over your slice of the pie. And there's still some degree of that. The more important argument to be made and efforts to be exerted on is how to make the pie bigger. And that's probably how I define. If I succeed in that in any way, small shape or form, then I know I'm helping support not just my organization, but other like organizations, for years to come.
Sure. Under some definitions, that would be collusion, but under this definition, it sounds more like we're just studying each other for best practices.
And
It,
that's actually true at both levels. So you cannot really talk about what I forget the term. It's called trade. There's
yeah,
you can't collude is
right.
is the point, and that's absolutely true. Nobody does that, or else you'd be on the front page of newspapers.
I wasn't trying to make news today,
Yep,
Craig.
yep, nope, nope. That's all very, very good. No, this is, and it's also best practices at the management level, at the funding level, and at the service level.
Mhm.
So again, I probably never would have answered that. That's certainly not where I felt my um, successes or worth 5 years ago. I would have said it's really developing better evidence-based programs and enhancing services and bringing a wider array of resources available for youth and families. And 5 years before that, it would have been, wow, we actually have developed a director and supervisor training program. So as a CEO, you do have to be flexible. I love the, as your podcast title is, resilient leader. We face challenges all the time, and you have to be able to roll with those punches. You have to be able to evolve. You have to be able to pivot.
Very cool. Very cool. Craig, one last question for you. Can you tell us who your favorite fictional character is?
My favorite fictional character. Well, you just had me thinking about leadership. I'm going to answer it with four answers. Well, with two answers between four people. At the management level, I always liken myself to two different things. I think a lot. And I'm dating myself here. Hill Street Blues. I always thought of myself as Captain
Oh,
Furillo,
sure. Be safe
and
out there today.
that, yep, and yeah, like I said, I'm dating myself. But I also, on that level, also thought of myself as President Bartlett on The West Wing.
Okay.
Both of them, day in and day out, get beleaguered with stuff that is bigger than any person can handle, and they have to figure out how to maneuver through that. And as a CEO, I always like to say, the easy problems are solved long before they don't reach your desk.
Sure.
They were reached, what hits your desk and your eyes are, the problems that very smart, conscientious, well-intentioned people weren't able to solve.
Yeah.
Now,
Oh, at least they should be. If you
and
develop
they,
the system right, they
that's,
should be that way.
that's,
95% of the decisions are made by lieutenants.
that's true. That's absolutely true. And that's true. Now, for fictional characters,
Yeah. Well, by the
I,
way, those two were fictional characters, so go ahead.
That's true. That's true. I would probably say somewhere between Bilbo Baggins and Harry Potter. So both of them, you know, lots of journeys, lots of fantasy, lots of great things. I don't slay dragons all that often or have a magic wand, but I do love all of them as well.
Well, maybe part of it, they're both English and they both know how to go invisible.
And there are days when that would serve me very well.
I bet it would. I bet it would. Well, Craig Gordon, CEO of Communities for People, it's been a real pleasure having you today. Thank you for joining us.
Thanks, Trent. Love it. Thanks for having me.
Resilient leaders face challenging currents, and it's tough navigating. But with one tack or another, we can get there together. If you enjoyed today's podcast, subscribe, Let somebody else know about it so they can get these journeys hot off the press. You can find us on LinkedIn, my YouTube channel, or you can catch us on Libsyn, Google Play, Spotify, Apple Podcasts, where else you get your podcasts. We will see you next time. Thank you, folks. Be well.